In the absence of immediate congressional action, which we are asking for and calling for again today on behalf of our agents, on behalf of the migrants who are vulnerable in our custody, to address this broken framework, we're going to be taking every action in our power to try to manage this crisis. We are applying the additional funding received in the fiscal year 19 budget for humanitarian purposes, extending our medical contracts to key sectors, including here in El Paso, so that we can care for more migrants more expeditiously as they arrive. We're augmenting our law enforcement assets with contract support for migrant care and food services. We're enhancing our transportation contracts and establishing new processing facilities, including a planned center here in El Paso area. We're redirecting 750 officers from key roles at our ports of entry. El Paso knows what those 6 bridges mean and that daily commerce with Mexico. We need those officers now, though, to help Border Patrol agents to care for migrants. CBP officers will be helping Border Patrol with processing, transportation, hospital watch. There will be impacts to traffic at the border. There will be a slowdown in the processing of trade. There will be wait times in our pedestrian and passenger vehicle lanes. We know that we have Semana Santa, Holy Week, approaching, but this is required to help us manage this operational crisis. We're calling up our mission support personnel, those who have volunteered to provide humanitarian assistance in a natural disaster, for instance, from across CBP, human resources specialists, IT professionals, to come down and help our Border Patrol agents manage this crisis. We're engaging non-governmental organizations and the faith-based community. Nowhere is that partnership stronger than here in El Paso, with the El Paso City and the emergency management team, with the Annunciation House and Ruben Garcia, to try to care for families of migrants that are being released from our custody. We're going to need to continue to partner with the Public Health Service Commission Corps to provide medical care in multiple locations across the border. I saw some of those dedicated uniformed doctors yesterday alongside our agents caring for migrants. And we are going to be taking steps to support safety in our facilities that are contrary to our enforcement objectives and our mission and culture. For the first time in over a decade, CBP is performing direct releases of migrants when ICE is unable to provide bed space to relieve overcrowding. We're going to be doing this on a risk basis. This is in a limited capacity. It's very reluctantly, but it represents a negative outcome for enforcement. It represents an increase in flows that will follow, and it impacts the morale of our team. But is the only current option we have from a life and safety perspective to try to reduce the overcrowding in our facilities. We are still setting court dates. These people will still eventually see an immigration judge, but this is an unfortunate step and very challenging for our law enforcement professionals to digest when they've sworn to protect the border and when they know that the vast majority of those that they encounter will not be granted relief by an immigration judge. They will not be granted permission to stay in the U.S. Even with all these steps, with the flows at these levels and increasing, combined with the lack of bed space for our partners, it means that we will be continued to be challenged to provide humane care for those in our custody.